Hello dear students, myself Bhavani Pentela, working as an assistant professor in Noida Institute of Engineering and Technology, Pharmacy Institute. In this lecture, I am going to cover the general anesthesia and pre-anesthetic drugs part 2. In previous session, I had covered the general anesthetic drugs. In that we had discussed about what is a general anesthesia, what are the features of general anesthesia, what are the stages of anesthesia and what are the techniques of anesthesia, and after of that we had discussed about the classification and mechanism of action. So, without any further delay, we will move into this today's session. So, here we will see the pharmacological actions of an individual drugs. In my previous lecture, I had explained what are the drugs falls under the general anesthetics and what is the mode of action of general anesthetic. These are the two important things you have to study in this session. So, what are the drugs falls under the general anesthesia? Mainly the general anesthetic drugs has been classified into two categories. What are they? Inhalation general anesthetics and second one is intravenous general anesthetics. One you can give by the inhalation anesthesia and second you can give by the intravenous anesthesia. In inhalation anesthetics, you can further classified into volatile liquids and gases. So, these general anesthetic drugs were been further classified into what are they? Inhalation and intravenous. In inhalation, you will see the volatile liquids and second one is gaseous. And what about the intravenous anesthesia? In intravenous anesthesia, you will see here fast acting drugs and slow acting drugs. What are the fast acting drugs? Inducing agents are the fast acting drugs. It will show its action very fastly. And what about the slow acting drugs? The slow acting drugs like benzodiazepines, opioids, neuroleptics, all these are the drugs which falls under slow acting drugs. When you had administered the anesthesia on intravenous route, this will shows its action slowly. And what about the inducing agents? The inducing agent will shows its action very fast. So, I had discussed about the mechanism of action also. So, the general anesthetic drugs mainly focus on the two things. One, it have to decrease the excitatory neurotransmitter and second thing was it have to promote the inhibitory neurotransmitter. By promoting the inhibitory neurotransmitter, it can produces the general anesthetic action, or by inhibiting the neurotransmitter like excitatory neurotransmitter, it can produces the general anesthetic action. On today's session, we will go with the individual drugs pharmacological action. The first drug was inhalation anesthetic drugs, specially ether. So, what are the inhalation anesthetic drugs? Inhalation anesthetic drugs are the drugs which can refers or which can be release the gases or vapors in the respiratory system to produce the anesthesia. How it will produces the anesthesia? It will release the gases, it will release the vapors into the respiration. By releasing of these gases and vapors into the respiration, it will produces the anesthesia. So, what is the inhalation anesthesia? One of the example was ether. Ether is very easy to administer. It is a very easily administered drug by the inhalation anesthesia, and the action was very slow. The slow onset and recovery will be seen with this ether. Post-operative nausea and vomiting will be observed with the ether drug. The ether drug will having the analgesic action. It can induce the analgesia. It can relieve the muscle relaxation. It can relieve the muscle relaxation. It means it having the muscle relaxant property, but the ether was highly explosive drug and it can irritate the respiratory system also. Okay, this is the major two drawback with the ether, but it is very easy to inhale, it is very easy to administer of this drug, but the major disadvantage of this ether inhalation drug was it is very much explosive, highly explosive drug, and this can causes the respiratory irritation. When you had taken this drug like ether, it will release the gas and vapor and which will causes the irritation in your respiration to produce the general anesthesia. This is the major drawback with the ether. And we will move to the next drug, nitrous oxide. So, nitrous oxide is a gas, it is a colorless and odorless gas at the room temperature. Okay, it is completely eliminated by the lungs. When you had administered this inhalation anesthetic drug like nitrous oxide, the drug after once it shows its general anesthetic action. How it is going to eliminate from your body? It will going to eliminate from the body by the help of lungs. By the help of lungs, it will be eliminated from our body. So, it is a very low potency drug. If I am talking about the ether, it having the high potency drug, but the nitrous oxide is a low potency anesthetic drug. Because of this low potency anesthetic drugs, the nitrous oxide drug you have to administer with some other drug. So, you have to give with some other inhalation drug. When you had given with some other inhalation drug, now these both drugs will show the synergic action to produce the general anesthesia. And one of the major drawback with this nitrous oxide was it will causes the megablastic anemia. So, what is a megablastic anemia? It is a type of anemia, it is a blood disorder. So, what is a megablastic anemia? The megablastic anemia, you can see the decrease in red blood cells. So, decrease in red blood cells, the red blood cells are the cells which will carry the oxygen, right. So, by taking of this nitrous oxide continuously or repeatedly or prolongation, this will causes the megablastic anemia. So, you should not administer this drug for a prolonged use. Because it will induce the megablastic anemia, and rapid induction will be seen with this drug, and the recovery is also very rapid, and it having very good analgesic property. So, this is about the nitrous oxide. The major drawback was megablastic anemia. Okay, next we will move to the inhalation anesthetic like Halothane. Halothane is also an inhalation anesthetic drug. It will induce the anesthesia by producing the gases and vapors inside the respiration. Okay, and it is a volatile liquid. So, Halothane will falls under the volatile liquid. Right, it is a volatile liquid at the room temperature. It is a very widely used general anesthetic drug. What is a very widely used general anesthetic drug? Halothane. It is a non-explosive. So, if I am talking about the ether is a very highly explosive, right, but this Halothane drug is a non-explosive, non-irritant. So, this is the drawback will be covered with the ether. So, the major drawback with ether was it is highly explosive and highly irritant to the respiration, but which you cannot absorb in the Halothane. So, if any person is irritant to the respiration, you can switch to this drug like Halothane, because it is very much less explosive and it cannot causes any irritation in the respiration, non-irritant drug, right. So, hangover like action will be seen when it will be dissolved in your lipid solubility. How much lipid solubility of the drug you can see, in that much you can see the hangover. So, the hangover is mainly depend upon the drug solubility in our body, right. And after of that, the risk of Halothane is also very much high when you had used it repeatedly. So, when you had used it repeatedly, it can causes the liver damage. So, the major drawback with this Halothane was liver damage. Okay, this is the liver damage. The major risk of the Halothane was liver damage when you are using in a prolongation therapy. When you are using for a long therapy, this anesthetic drug, it can causes the liver damage. Okay, and this will be metabolized by the cytochrome P450 enzyme. It is an enzyme which is responsible to metabolize the drug. Which drug it is? Halothane. Halothane drug is metabolized by the cytochrome P450 enzyme which is present in the liver. So, this is the reason why this is the enzyme which is present in the liver. When this drug entered into the liver for the metabolism, it will damage the liver. So, this is the main reason how it will damage the liver here, right. And this is the drug which is very much commonly used in children. For if you have to give any general anesthesia for the children, the preferred one is the Halothane. So, Halothane is a very common anesthetic drug used for children. Okay. And these drugs has been packed in the umbilical bottles with the thymol preservatives. So, this is about the Halothane. Halothane is a widely used anesthetic drug. The only drawback was it causes the liver damage when you had used it in the prolonged therapy. It do not causes any irritation in the respiration. It is a non-explosive drug. Okay. And this is widely used in the children, and the hangover will be seen when it is very much dissolved in your lipid bilayer. Next one, N-fluorine. N-fluorine is a drug which is a halogenated anesthetic drug similar to the Halothane. So, the N-fluorine drug, its action is almost similar to the Halothane, less metabolism. So, the less metabolism than Halothane. So, the Halothane is a drug which will be metabolized by the cytochrome P450 enzyme in the liver, but the N-fluorine drug is a less metabolism than Halothane. So, it cannot produces any liver damage. So, the liver damage, the risk of toxicity on the liver was very less with the N-fluorine, right. the faster induction and recovery than halothane. If I am comparing this enflurane with the halothane, it is almost similar to the halothane, but you can see the faster induction and faster recovery compared to that of halothane. Okay? And there are somewhat risk with epilepsy. The risk of epilepsy like seizures you can see with the enflurane drug. So, each and every halothane drug it having its own major drawback, right. If I am talking about either the major drawback was respiratory irritation. If I am talking about the next drug nitrous oxide, it will causes the megablastic anemia. If I am talking about halothane, it can causes the liver damage, and if I am talking about the enflurane drug, it can induces the epilepsy like seizures. So, every anesthetic drug, every inhalation anesthetic drug, it has its own toxicity action. So, if the dose has been increased in a little more, every anesthetic drugs will produces the more toxicity. And next drug was sevoflurane. Sevoflurane is a drug which is similar to the desflurane with the lack of respiratory irritation. But if I am talking about this desflurane drug, so what the drug it is? Desflurane. The desflurane is also a drug which causes the respiratory irritation same like ether. So, desflurane, ether, all these are drugs which will induces the respiratory irritation when the gases has been released in the respiratory tract, but this is not seen with the sevoflurane. Next we will move to the next drug, isoflurane. Okay, isoflurane is also similar to the enflurane drug and with the lack of epileptogenic activity. So, you can see, you do not see here any seizures, you can't see any epilepsy here. So, lack of epilepsy, lack of seizures you can see with this drug. Which type of drug it is? Isoflurane. Isoflurane is a drug which having the lack of epileptogenic activity. Okay. It may precipitate the myocardial ischemia, but the major drawback with this drug was it can precipitate the myocardial ischemia. Myocardial ischemia is the major drawback with the isoflurane drug. Which type of drug it is? It is an inhalation anesthetic drug and it causes the respiratory irritation. Okay, when you had given the inhalation anesthetic, this inhalation anesthetic will released into the respiratory tract by means of vapors and gases, and these vapors and gases will causes the irritation in the respiration. So, this irritation you can observe with the isoflurane drug also. The only drawback with this, major drawback with this is myocardial precipitation. So, myocardial precipitation is a major drawback with the isoflurane, but you cannot see any seizures here. Okay, there will be no seizures, there will be no epilepsies, and but the irritation, somewhat respiration you can observe here. And next one is desflurane. So, what is the next drug here? Desflurane. Desflurane is a drug which is similar to the isoflurane, but it having the faster onset and recovery action. So, if I am talking its onset, the onset of action is very much fast compared to that of isoflurane, and recovery is also very fast compared to that of isoflurane. There will be the respiratory irritant same like isoflurane. So, isoflurane also will causes the irritant action on the respiratory system, desflurane also will causes the irritant action on the respiratory system. So, if you have to use the day case surgery, if you have to use in a day case surgery, the preferred one is desflurane drug. And next one is intravenous anesthesia. Intravenous anesthesia is a drug which can given by the intravenous route. Intravenous anesthesia has been classified into two types. They are fast acting drugs and slow acting drugs. Fast acting drugs are also called as an inducing agents, and slow acting drugs are false. The slow acting drugs are like benzodiazepines, opioids and neuroleptic agents. So, these are the drugs which will falls under slow acting drugs, but all the drugs, the inducing drugs, benzodiazepines, opioids, neuroleptic drugs, all these are the drugs which are given by the intravenous route to produce the anesthetic action. Okay. Now, we will see about the drug thiopental sodium. So, thiopental is an ultra short acting barbiturate. What type of drug it is? It is an ultra short barbiturate. It is a barbiturate drug. What type of barbiturate? It is an ultra short barbiturate. Okay, it is an ultra short barbiturate drug. There will be no analgesic action. You cannot see any analgesic action with this thiopental, but the lipid solubility is very much rapid and it will enter into the brain. So, due to because of this high lipid solubility, the lipid solubility is very much high. Due to this reason, how much it will be lipid solubility, how much it has been increased, it can easily penetrate into the brain. So, the entry of the thiopental into the brain will also be very fast due to because of its lipid solubility. right. And next one is it will be metabolized. It is not metabolized, it is the effect is not metabolized by it, the effect is terminated not by metabolism, but by redistribution. Okay. So, how the action of thiopental will be eliminated from the body? By redistribution, but not by the metabolism. This is the very important point you have to remember in your competitive exam as well. So, if you am talking about this sodium, what this drug? Sodium pental. The sodium pental drug can eliminated from the body by its redistribution, but not by its metabolism. Okay. And the risk of severe vasospasm. So, here the risk you can see, the vasospasm is a risk which you can absorb here. And what is a vasospasm? Vasospasm, it means it is a constriction of an artery. So, constriction of an artery, so constriction of this artery can causes, what it means constriction? Narrowing of an artery. Vasospasm is nothing but narrowing of an artery. By narrowing of this artery, there will be the constriction of blood vessels, and finally, you can see the vasoconstriction action. Okay, the risk of severe vasospasm will be seen with this thiopental sodium, and accidentally when you had administered on the artery, you can see the vasospasm. What is mean by vasospasm? Constriction of an artery. It means constriction of an blood vessels, right? And it will decreases the cerebral blood flow. It will decreases the cerebral blood flow. It will decreases the intracranial pressure. What is the intracranial pressure? The pressure seen inside the brain. Inside pressure, cranial and brain. So, if the pressure is absorbed inside the brain, then it is called as an intracranial pressure. So, the thiopental drug will decreases the intracranial pressure. Okay. So, thiopental is an intravenous anesthetic drug. It is an ultra short acting barbiturate, and it do not having any analgesic action, and it is due to because of its high solubility, it can penetrate into the blood, it can crosses into the blood, or it can enter into the blood, right. And the action will be terminated by the redistribution, but not its metabolism. The major drawback with this thiopental was it can produces the vasospasm. Why it is happening? The vasospasm is nothing, it is a terminology where you can see the narrowing of an artery. What is the reason for narrowing of an artery? When the blood vessel has been constricted. So, this vasospasm is due to because of constriction of any blood vessel, especially artery. You can induce the vasospasm. When the vasospasm is absorbed, when you had accidentally injected into the artery, when you had injected this drug into the artery, you can see the vasospasm. And next one, the cerebral blood flow will be get depressed, and next one is the intracranial pressure it also will be decreased with the thiopental. Okay. And the next intravenous anesthetic. Next intravenous anesthetic, what is the next intravenous anesthetic? Etomidate. Etomidate is an intravenous anesthetic which is similar to that of a thiopental, but it having more quickly metabolized, but it is more quickly metabolized. If I am talking about thiopental, in the previous slide I had explained you thiopental will not be metabolized. How it will be terminated? It will be terminated by the redistribution, but this drug Etomidate, what the drug it is? Etomidate. Etomidate is similar to the thiopental, but more quickly metabolized. So, thiopental is a drug which is not metabolized, but the Etomidate drug is similar to the thiopental, but it having it will be metabolized. Okay. The less risk of cardiovascular depression. So, if I am giving any this drug Etomidate drug, when you had administered by the intravenous route. So, if I am administering this drug by the intravenous route, what is going to happen? Here the less risk of cardiovascular depression. There will be very much less effect on the cardiovascular depression. So, by administration of this drug, there will be no depression of an cardiac muscle. There will be no fall in blood pressure will be seen with this Etomidate drug. Okay. And if I am talking about these causes, it may causes the voluntary movement during induction. So, when you are inducing this Etomidate drug during induction, it may causes the voluntary movements. The voluntary movements you can see with these drugs when you had induced, right. The possible risk was adrenocortical suppression. So, adrenocortical suppression was a possible risk. This is a major risk you can see with the Etomidate drug. Okay. Etomidate, I am repeating one more time, Etomidate is an intravenous anesthetic drug. It is very much similar to the Thiopental, but this drug is very much metabolized in your body and it having very less risk with the cardiovascular depression, and this may causes the voluntary movement when you had induced it during the induction of this intravenous anesthetic. You can causes the involuntary movements, and the risk, the possible risk was adrenocortical suppression. So, the adrenocortical suppression will be seen when you had administered this drug to produces the general anesthetic action. So, this is the major drawback here. Okay, this is the major drawback. The possible risk was adrenocortical suppression. Okay, next we are moving to the ketamine. So, what is the drug it is? The ketamine is also a general anesthetic drug which falls under intravenous category. Okay. So, it is an intravenous general anesthetic drug. So, if I am talking about this ketamine, it is an analog. Which type of analog? It is an analog of phencyclidine with similar properties. Okay. The action differs from other agents. So, if I am talking about this ketamine, the action will be differ from the other agents. So, other intravenous agents, if you are comparing with the other intravenous agents, the action will be very much different with with this ketamine drug. Probably it is related to the effect on NMDA type of glutamate receptor. So, if I am talking about this ketamine drug, so this ketamine drug will concentrate on the excitatory neurotransmitter inhibition. So, it will be mainly focused on NMDA receptor. So, NMDA receptor is a responsible receptor for the excitation of a cell which will induces the pain. So, the ketamine drug will mainly concentrate or mainly focus on this type of receptor. Which type of receptor it is? NMDA receptor. So, it will focus on this receptor. So, this is a receptor which is responsible for the opening of calcium channel. By opening of this calcium channel, which may causes the depolarization of a cell and which can induces the pain. So, the ketamine drug will block this NMDA receptor. By blocking of this NMDA receptor, there will be no opening of calcium channel. Why there is no opening of calcium channel? Because there will be no excitatory neurotransmitter go and bind to this receptor, because this receptor has been blocked by this ketamine drug. If there is no binding of excitatory neurotransmitter, there will be no opening of a channel. If there is no opening of a channel, especially sodium or calcium, there will be no depolarization inside the cell, there will be no excitation of a cell, there will be no induce of a pain. So, in such a way, the ketamine drug will shows its anesthetic action by inhibiting the excitatory neurotransmitter, especially it will bind to the NMDA receptor. Okay? NMDA glutamate receptor. The onset of action was relatively very slow. When you had given the drug ketamine, the onset of action was very slow. It means 2 to 5 minutes. The action will be 2 to 5 minutes. The relatively onset of action was very low. The high induced of dysphoria, hallucination, you can say when you had administered this ketamine drug, you can see some side effects like dysphoria, hallucination. What is dysphoria? It is a psychological disorder, mental disturbances. Okay, this is mental disturbances due to because of a stress, okay, family problems, relationship disturbances, all this due to because of this reason you can see the psychological disturbances which you can termed as a dysphoria, and you can see the hallucination, false imagination. This is called this is the things which you can observe with the ketamine drug. The ketamine drug, when you had given or when you had administered, you can see the high incidence of dysphoria and hallucination, and it will rises the intracranial pressure. What it will do when you had administered the ketamine in intravenous drug, it will increases the intraocular pressure, not intraocular pressure, intracranial pressure. Intraocular pressure is different to that of intracranial pressure, which is related to the eye. Intracranial is related to the brain. This is the drug which will increases the intracranial pressure. The intracranial pressure will be get increased with the ketamine drug. So, these are the general complication here. When giving the anesthesia, during anesthesia you can see the respiratory depression, the cardiac arrhythmiasis, you can see in the fall in blood pressure, you can see the convulsions, delirium, all these things happens when you had given anesthesia, during anesthesia. Okay, during anesthesia you can see all these things, respiratory depression, delirium and cardiac activity. After anesthesia, after giving of anesthesia, what are the complications you can see? Nausea, vomiting, sedation, pneumonia. Sometimes you can see the major organ damage like liver and kidney, cognitive effects. All these are the disadvantages. Okay. And what are the contraindications? So, there are some contraindications with these general anesthetic drugs. So, these general anesthetic drugs should not prefer in such a conditions like diabetes, asthma, high blood pressure, smoking, and especially in alcohol intakes. So, in such a condition or in such a patients, you should not administer the general anesthetic drugs. In which condition you should not administer the general anesthetic drugs? Those patients who having the diabetes, those patients who are suffering from the asthmatic problem, those patients who are having the relatively high blood pressure, those patients who are having the smoking habit, and those patients who are having the alcohol intake. In such a condition, you should not administer, or this drug will be the complicated in such conditions. What is about the pre-anesthetic medications? The pre-anesthetic medications are the drugs where you can give in before the anesthesia. Before anesthesia, you can give the pre-anesthetic drugs. The main aim of these pre-anesthetic drugs was it produces the analgesia, it will relieve the excitation, okay? It will produces amnesia on the post-operative sanction. Mainly these pre-anesthetic medication you will give before the anesthesia, before giving the general anesthetics. So, these are the some drugs which falls here. So, sedatives and anti-anxiety drugs you can use as an pre-anesthetic drugs, anticholinergic drugs you can use as an pre-anesthetic drugs, neuroleptic drugs, opioid drugs, histamine blockers, and anti-epileptic drugs like ordinine serotonin. All these are the drugs which falls under pre-anesthetic medication. All these are drugs are advised to give in the pre-anesthetic medication. So, all these drugs are the pre-anesthetic drugs which are given before the anesthesia. So, what are the drugs? Sedative drugs, anticholinergic drugs, neuroleptic drugs, opioid drugs, histamine, and anti-emetic drugs. Thank you.